Now for the next orthopedic issue which we are going to discuss, we'll talk about acute joint swelling after an injury. Acute joint swelling after an injury. So for acute joint swelling after an injury, this is it's just literal. So having a joint swelling after an injury, okay? So it's just that the joint swells after a trauma. So it's a critical sign in orthopedics, and the swelling might be due to several reasons. Maybe the person bled into the joint, maybe there was fluid accumulation, maybe there was inflammatory responses within the joint. You understand that kind of thing? So causes could be due to what? Hemarthrosis. That's bleeding into the joint. Okay, could be all those ligament tears, fractures extending into the joint. Then meniscal injuries now present with rapid swellings, synovial effusions. Like the swelling after the injury is something that will actually help you, think about what is actually wrong inside the joint. You understand? So it could be synovial effusion, reactive synovitis after minor traumas. Okay. So fractures associated swellings, that when you have intra-articular fractures causing bleeding and fluid leaks, and also soft tissue injuries around the joint. You understand? So clinical features is there's rapid swelling, there's pain and restricted movement. Of course, you're not able to use that part of the body like you used to, So there's also instability or mechanical block. So diagnosis is all those clinical examination. We are looking at the history, when it started, and how far has it actually affected the patient. You diagnose from all these X-rays, MRI, arthrocentesis. Okay, then you try to also access the joint where you are seeing what the blood has stained the synovial fluid. Okay, management is what? Rest, okay, and you keep that place cooled, and analgesics for pain relief. Arthrocentesis just to relieve the pressure. You can repair the ligaments, repair the meniscals, and also fix the intra-articular fracture.